Last Tuesday, David Chen got a phone call that almost ended his business. The caller was Medicare, and they had some very bad news about his home health agency. But before I tell you what that phone call was about, let me ask you something. How many of your patients missed appointments this week? Because every single no-show is costing you more than you realize. And there's something happening in home healthcare right now that most agency owners are completely blind to. Today, I'm going to show you the hidden profit killer that's bleeding agencies dry, reveal the controversial technology that's letting smaller agencies steal patients from industry giants, and expose why some agencies are thriving while others are closing their doors. But first, let me tell you about David's nightmare phone call. So the Medicare representative said, "We've identified a pattern of care disruptions at your facility. Patients are reporting missed visits, medication non-compliance, and multiple hospital readmissions. We're placing your agency under review." David's blood went cold. A Medicare review could shut down his 15-year-old agency. But David thought his operation was running smoothly. His nurses were excellent. Patient satisfaction seemed fine, and the revenue was steady. What David didn't realize was that his agency was hemorrhaging money through invisible cracks. 12 missed visits per week. At $140 per visit, that's $87,000 annually in lost revenue. But the real damage was deeper. Those missed visits were cascading into medication errors, hospital readmissions, and the kind of compliance issues that destroy agencies. I was managing what I could see. David told me 6 months later, but I was completely blind to what was killing my business. You know what most agency owners wouldn't want to admit? Traditional patient communication is broken. Let's say Mrs. Johnson calls your agency at 8 p.m. because she's confused about her medication. She gets voicemail. Frustrated, she skips her evening dose. By morning, she is feeling worse and calls 911 instead of your agency. That's a $30,000 hospital readmission that started with an unanswered phone call. The US healthcare system loses $150 billion annually to missed appointments alone. Home health agencies operating on razor-thin margins can't survive this kind of waste. But what did the agencies that are thriving right now discover? Something their competitors haven't. It's that they've stopped trying to hire their way out of communication problems. Instead, they've deployed AI voice agents that handle patient calls better than most humans. Before you roll your eyes and think about, robotic phone trees, let me show you how exactly this works. It's 11:47 on a Friday night, and Robert Wilson is in his living room, a pill bottle in his hand. He's been in a mental fog all day, and for the life of him, he can't remember if he took his blood pressure medication. His wife is out of town. His kids are grown and gone. And the thought of waiting until Monday to ask someone for help is a knot in his stomach. He dials the number for his home health agency, bracing himself for the recorded message he knows is coming. But the phone rings just once before a calm, human-sounding voice answers.
Hello, Mr. Wilson. This is Nicole, your health assistant. I can see you're calling about your medication. Are you worried you may have missed your evening dose?
Yes, exactly. I am just so confused.
I understand. Let me check your schedule.
Given the time, the safest thing to do is to skip tonight's dose. I've made a note of this for your nurse and sent her a message to call you first thing in the morning. Everything is taken care of. In 5 minutes, Robert had a clear plan. He hung up and went to sleep. The panic gone. I bet you he didn't even know he was talking to an AI voice agent. But the important thing is that someone answered the phone when he really needed them. The best technology doesn't feel like technology. It just solves a problem. We all know the problem. The phone rings off the hook with routine questions, and your staff is buried in messages and follow-up calls. Even your best scheduler can't be in a dozen places at once. AI isn't about replacing those people. It's about giving them superhuman reach. When the AI calls Mr. Thompson to remind him about his visit, it doesn't read a script. It has a real conversation. Hello, Mr. Thompson. This is your health assistant. I'm calling about your visit with Nurse Patricia tomorrow. She'll be checking on your wound care. How has your pain been since your last appointment? If Mr. Thompson mentions increased pain, the AI can immediately flag that for the clinical team. It turns a simple reminder into a real-time health check. This is the key difference between agencies that get it right and those that fail. David made the mistake of thinking of AI as a cheap receptionist. His first attempt was a disaster. He bought a voice bot that sounded robotic and frustrated his patients. His satisfaction scores plummeted. But then there is Maria. Her agency used AI to handle the routine tasks like visit confirmations and medication reminders. But when a patient had a complex need, the AI seamlessly transferred the call to a human nurse. Maria's nurses spent 80% less time on phone calls and more time giving care. The change for David's agency was remarkable. His no-show rate dropped from 25% to just 8% in 30 days. Patients could always reach a person, even if it was a virtual one, and his satisfaction scores went up. The AI also created perfect documentation for every call, turning his stressful Medicare review into a commendation. David's agency now handles 40% more patients with the same staff, and their patient retention rate is 95%. The AI didn't replace our human touch, he said. It gave us a superhuman reach. The agencies that are using this technology now are building a competitive advantage that's almost impossible to match. While their competitors are still struggling with staffing shortages and communication breakdowns, they're growing and providing a level of service that no one else can touch. I've seen these agencies in Southern California close in the last year, not because their care was bad, but because they couldn't compete with the superior communication their AI-powered rivals offered. The window to get ahead is closing. Early adopters are creating a new standard of care. Those who wait will find themselves playing catch-up in a market that's already moving on. Oh, and if you're running a home health agency, you need to know about the CMS updates that went into effect this year. Watch this video next because missing these could result in claim denials, payment suspensions, or worse, and I'm seeing agencies get caught off guard every single day.